All right. Hi, everyone. My name is Saumya Khullar. I'm an exercise physiologist at the Inspire Institute of Sport. And today we're going to talk about the topic of relative energy deficit in sport. So this is a fairly new topic that was introduced by the IOC, which is the International Olympic Committee, in 2014 as an extension of what is already known as per the energy deficiency in sport, which is the female athlete triad. So what I'm going to be discussing today during this presentation would be a little bit on the etiology of relative energy deficit. So what is energy availability? How does relative energy deficit happen, which is because of the low energy availability? We'll be discussing upon the health consequences and the performance consequences of REDS for an athlete. If you have any questions or comments during the presentation, please feel free to drop them in the comment box and we can go back to those later after the presentation is over. At the end of the theoretical part, once we've discussed what is relative energy deficit in sport, its consequences on health and performance, we'll be then discussing upon the practical framework that we use at the institute here at IIS. So, of course, it's been recognized by few pioneers in the field of how important REDS is and how important it is to identify, to screen the athlete in a timely manner, just to make sure that we can limit as much consequences of low energy availability on an athlete's health and performance. So coming up with an assessment tool, a pre-screening tool, appropriate treatment strategies, all of that is very important. So we'll be discussing and going through all of that today during the presentation. So like I mentioned, if you're going to understand REDS, we need to go a few steps behind and start really from what the energy availability means. So if you're looking at energy availability, it is nothing but a balance between the dietary intake, so say the food that I'm eating in, and minus the energy that I expend during exercise. So if I'm eating this much calories and I'm expending this much, the balance of the energy available is known as the energy availability. And it's of course going to be in kilocalories if you're talking about calories. So for example, if you're eating 2,500 calories, expending 2,000 calories, so 500 calories would be your energy availability. So just digging in a little deeper into the concept of energy availability and how we understand this concept for an athlete. So what really happens is if an athlete is eating adequately and able to manage the diet based on the training load, an athlete would be considered to be in an ideal scenario. So that athlete would be healthy, there would be no signs of low energy availability, no consequences on any of the physiological systems, especially the endocrine system, and an athlete would be considered healthy. So what we are looking for is really a good match between energy intake and energy spent. However, if you look at the extreme left and the right cases, this is where the energy availability is inadequate. Now, it can be because of two reasons. It can be either because of an imbalance between energy intake, because of a high training load, or vice versa. So it can be that an athlete is eating a lot, however, the training load is not able to match the intake of an athlete. So say in the cases right now when an athlete is mostly stuck at home and not at the training centers, if we look at the energy intake, we need to be really mindful that the athlete is aware of how they need to tweak those changes. So if they're not exercising as much as they would when they are in an institute setting or a camp setting, they need to make sure that they're eating appropriately, because you don't want the athlete to come back and their body composition is very different from how they left the institute before the corona hit. So we need to make sure that we are able to match it adequately at all times. So if the athlete is so a classic example would be, say, in combat sports athletes. We work here with combat sport athletes. So, during or before, right before the competition, the athlete would try and keep their training level as high as possible because they want to be fit. However, what they'll do is they'll try and cut down on the amount of energy that they're taking in. So that would, of course, be limiting the food intake. But in cases, we've seen that they also start to dehydrate themselves. So that would really be a classic example of how an athlete has started to fall into an a low energy availability state. So let's just remember that it has to be matched between the energy intake and the training load. So a low energy availability would be a classic case of mismatch between those two variables that we discuss. So either an athlete is eating very much, not exercising enough, or vice versa. And what that would lead is to an inadequate energy for the body to support the other systems. So, of course, the body is going to start and compromise on certain systems just to make sure that the vital processes are still functioning. If you're looking at defining what a low energy availability would be, classically, it's anything less than 30 kilocalories per kg per fat-free mass. So typically, we would expect an athlete to be about 45 kilocalories per kg per fat-free mass. However, if an athlete is continuing to be at 30 or less over an extended period of time, so if it's a case of chronic low energy availability, then the athlete would be really susceptible to fall into the red S bracket. Now, if we look at how we know low energy availability historically, it's always been associated with what we commonly know as female athlete triad. So here on the right, we'll see like a classic case. We want our athlete to fall into this right green bubble where the athlete is healthy, they're eating appropriately, they are getting regular menstrues, so they're eumenoric, no problem with the menstruation, and as a result, they're maintaining an optimum bone health. So we want our athlete to fall on this right side of the screen. However, because of any reason, because of, say, acute weight loss, because of eating disorders, if an athlete starts to fall into a low energy availability, we would see the athlete shifting towards the left of the screen into this red bubble where athlete will present with low energy availability. We would able to see direct impact on the hypothalamus function, causing a primary amenorrhea where there's a loss of stimulus for the hypothalamus to stimulate the pituitary gland, to stimulate the uterus, and less of release of progesterone and estrogen, which is responsible for normal menstruation. So we will see a direct impact on the hypothalamus, and as a result, an athlete would show signs of low bone mineral density and fall into the category of osteoporosis. So this is what we historically knew about the consequences of low energy availability, only limited to a female athlete. However, in 2014, so very recently, what IOC did was they tried to expand upon this concept, make it a little more comprehensive, make more broad, and introduce the term of relative energy deficiency in sport. So what that means is it's not just valid for the female athletes, it's also very applicable for the male athletes. Of course, the effects are going to be different slightly when we're talking about individual body systems, but the big difference that relative energy deficiency brought in was not only that it's limited to the triad, and not only is it limited to the females, but it covers a whole lot of spectrum. So if you look at the definition here, it's not just limited to the metabolic rate and menstrual function, but it's also affecting other systems, immunity, protein synthesis, cardiovascular health, everything. So just looking at a glance of how it would affect our health. So if an athlete is falling into a category of red S, so here we see on the screen, if you can see my mouse, I'm not sure, but this is the classic triad that we just discussed. So because of low energy availability, the athlete will have, maybe miss their periods. As a result, be more susceptible to sprains and fractures and whatnot. But it's also affecting the other systems. So if you look at the metabolic system, the athlete would present with low metabolic rate. If you look at the growth and development, the growth of and development of the athlete would be stunted. There would be, the athlete would present with a lot of gastrointestinal symptom, and it's one of the variables that's also considered very important when it comes to low energy availability. So when I say a gastrointestinal system would be affected, you'll see that the athlete is complaining of constipation, they're going to the washroom, passing stool more often. And of course, we'll see the results on hematological profile of an athlete. So all the more relevant when we're talking about an Indian athlete and an Indian female athlete, because I cannot stress enough how important all of a healthy diet and energy availability state is so important for an athlete. So what we observed here also at the institute, that the athletes are already so predisposed to a low iron level. When we screened our athletes here, almost like 90% of female athletes showed signs of low iron in their body. So of course, if you're not eating, that's going to directly impact on that, which is also going to impact on an athlete's endurance and performance. So all of these factors are as a result of REDS. So it's not just focusing on one system, but it's affecting, an athlete at a greater extent. The psychological consequences, the cardiovascular consequences, all of those would play an important role when we're talking about an athlete's health. Now, if we look at, now quickly looking at the performance consequences of REDS. So like I said before, not only is it going to affect an athlete's health, but it's also going to affect an athlete's performance, which is, of course, of matter to all of us working with athletes. So if we look at, say, starting this side of the spectrum, an athlete would become at an increased risk of injury. So if we look at an athlete's profile and they're not eating well and they're constantly in a state of low energy availability, either on purpose because of acute weight loss or because of an eating disorder, we'll see that the athlete is not recovering properly. As a result, they're they're increasing the chances of overreaching, overtraining, hence injury risk. There will be reduced training response. So of course, if the athlete is not eating enough, there's low carbohydrate intake, because we know that Indian diet consists of a big quantity of carbohydrate. There's going to be decreased training responses because of the less glycogen intake. So the stores would be low, the protein synthesis would be low, because knowingly or unknowingly, the athlete would also start to cut down on their protein intake. And we know how all of that is very important for an adequate training response and an adequate recovery for an athlete. The same way, the muscle strength would be going down because of problem with protein synthesis, decreased glycogen stores, depression, irritability, decreased concentration, coordination. These would definitely come into practice when we're working with sports such as boxing, where coordination and concentration is so important. So as a result of the health, it's directly impacting performance potentially for an athlete. Sorry about that. I don't know why it keeps getting frozen. All right. So which are the athletes that are the most at risk of REDS? So if you want to say prioritize screening them, I'm not saying we shouldn't screen all of them, but if you want to prioritize and start somewhere, we should definitely look at athletes which are involved in gravitational sports. So that would be mostly track and field athletes, endurance runners, jumpers, weight category sports. So If you're working with combat sports, wrestling, judo, boxing, MMA, taekwondo, there's so much research on bad practices of weight loss and athletes belonging from such sports. So that should definitely be high on the priority list if you're working with these athletes. If you're working with any athletes which are aesthetically judged, so gymnastic, figure skating, all of these athletes are going to be very conscious about how they're looking. So a lot of body image issues could be identified with such profile of the athletes. So screening them and identifying them would be very important. Of course, if you're working with cyclists, rowers, jockeys, mostly male athletes belonging to these sports would be considered at risk. So if you're working with these athletes, it's absolutely important that we start screening them and working upon it. So how are we going to screen? There are a few methods that have been suggested by the International Olympic Committee. So if you look at the first one, which is periodic health assessment. So what that would mean is semi-annually or annually, however the system is at the institute or the center you're working at. So what that would include is a thorough blood profile check. So not only the complete blood count, but also liver profile, kidney profile, a thorough examination for the athlete, including a consultation by a sports physician, a stress ECG, a resting ECG, echocardiography, maybe even pulmonary function test. So a thorough screening of the athlete health in a timely manner. Second would be pre-participation physical examination. So that is mostly which is known as PCMA, so pre-competition medical assessment, which would include your thorough athlete history. So athlete's history, including the competition history, if they've got through any injury, any surgery. What would also be of relevance here would be the family history. So if an athlete is predisposed to any conditions, we of course need to know that. This would also include an athlete's musculoskeletal assessment, so a thorough assessment by the physiotherapy department, which would include range of motion, MMT, all those parameters. What we could also include here is an anthropometric profile for an athlete. So that would be something which would also shed light on if you're thinking of tracking an athlete and being able to identify if they're at risk of low energy availability. What's also recommended by the IOC is a questionnaire, which is called Low Energy Availability in Female Questionnaire. It's a validated screening tool, which unfortunately is only available for the female athletes right now, but I believe they're working on a similar questionnaire for male athletes as well. So what this questionnaire does is it basically assesses an athlete on 3 important variables. The first one being the injury variable, where we would ask athlete questions such as, have you been out of the competition? If yes, then for how long? Which areas were injured? So just trying and getting an injury profile for the athlete. The second variable that the questionnaire assesses is the gastrointestinal symptoms. What I mentioned was one of the major consequences of health for REDS. So again, we're going to try and assess the athlete based on their gastrointestinal symptoms, which would include whether or not they are bloated, they're getting cramps, which are not going to be related to the menstruation. Of course, if an athlete is menstruating, we could expect such symptoms of cramps and stomachache, but this is without an athlete being on her periods. Is she still complaining of such symptoms? This also includes questions such as how is your stool? Is it normal? Do you have diarrhea? How frequently are you passing stool? So just getting a gastrointestinal profile for an athlete. And one of the big variables that this questionnaire assesses is the menstrual dysfunction. So which would include questions such as, when did your athlete reach menarche? whether or not your athlete is using oral contraceptive pills, how is your athlete responding to changes in menstruation based on based on the exercise intensity, exercise duration, things like that. So really getting a full profile. And I mean, for us, it's been really helpful because not only have we been able to get other information from this profile. Say, for example, if I'm filling up a leaf queue with an athlete and I see that they are 15-year-old and they still haven't started their period or still haven't reached their menarche, it's an important flag for me. Then I know that I need to, sit with this athlete, maybe even send them for further investigation, send them to a gynac. So information from this questionnaire can be used, really depends on you how much you can use it, but it's an extensive questionnaire, and based on the score of the questionnaire you'll know whether or not an athlete is at risk of developing female athlete triad. And lastly, what's been recommended by REDS is a REDS clinical assessment tool, or a REDS CAT. So let's just go ahead and look at what the REDS clinical assessment tool looks like. All right, so I've just tried and put like a small image of what the clinical assessment tool looks like. Of course, it's much more elaborate than what this is, but just to give you all an idea of how they classify and risk the athlete based on a red light or a yellow light or a green light. I just wanted to put this picture and speak about it a little more. But if you look at the paper, it's a much extensive list of symptoms that or signs that you'll be identifying in an athlete, and classify them accordingly. So if we have an athlete, for example, with an eating disorder, anorexia or bulimia, then of course the athlete is going to fall into a high risk category, and then actions would be taken based on that. Similarly, if we have an athlete with a low bone mineral density, or not getting her periods for 3 months or more, amenorrheic for more than 3 months, or not reaching menarche by the age of 15, so the athlete is going to tend to fall into a yellow light category, which is going to be at moderate risk. And similarly, if we have an athlete who's healthy, who's getting her periods regularly, no signs of repeated injuries, healthy endocrine system, that athlete will fall into a green light system. And based on these 3 lights, what REDS, what IOC did was they came up with a return to play model. So of course, if an athlete is falling into a high risk, then you do not have to let the athlete be a part of any competition or any training. If an athlete is at moderate risk, it's going to be modified. You see that the athlete is training under medical supervision, things like that. And if it's an athlete is in a green light system, no problem, the athlete can go into a full sport participation. So I think it's a really interesting way to come up maybe with your own yellow light or red light or green light systems, because we have to be mindful that all of these may not be directly relevant to the population you're working in with, or even say if we have any specific signs that we've noticed in the Indian athletes, we can always be a little more creative and see that, okay, let's just make sure that in our system we include this in the red light, or we include this in the yellow light. So we have to be a little, creative and mindful of how well we use such a tool. And then just sharing how this system would work in an environment. This is definitely a teamwork with the help of a multidisciplinary team. So mostly at our institute, and what I've seen across other institutes in the world as well, it's mostly the exercise physiologist who is driving such a project. But it's not just the XPhys, but a lot of contribution from other practitioners such as a nutritionist, a psychologist, a sports physician, gynecologist, and the other members of the team. So I can't stress upon the importance of other members of the team, of course, which will be based on how the athlete is presenting the symptoms. If it's cardiovascular system, that we think is effective, we need to make sure that the athlete is getting a consultation with a cardiologist. Or if it's an eating disorder, the first point of contact, of course, is going to be a nutritionist and maybe even a psychologist. So making sure that you're, sending the athlete to the right person early on in the process and being really proactive about it can make a big change. So I then wanted to talk about the practical framework and a little bit about what we are doing here at IIS. So about more than a year back, we started a female athlete project at IIS, where we try to incorporate whatever recommendations are from the IOC, of course. But we also tried to make certain changes based on our observation and based on the athletic population that we are working with. So I just wanted to take this opportunity to discuss with you how that would fall into a practical setting, how you could come up with, say, a decision tree like we did in order to streamline the process and make sure that everyone is on the same page, and would require an involvement of a multidisciplinary team. So here is what our decision tree at for the female athletes at IIS look like. Don't worry, I'm going to explain and we're going to go through this slide. I know it's a little bit overwhelming and there's a lot going on here, but it's really very simple. So what we are doing for an athlete is basically divided into every month. So there's a system that's going in every month, which is going to be a menstrual tracking. Semi-annually is when we're doing a psychobiological assessment for the athlete, which mostly consists of the questionnaires that we're filling up with an athlete to identify whether or not they are at risk of female athlete triad, mood disturbances, and eating disorders. And thirdly, if you see on the right top of my screen, is health monitoring, which is done quarterly to annually. So the tree or the system is basically running in three categories. So a monthly system, and then a semi-annually, and an annually system. So what we do every month here for our athletes is we track the female athletes we have. So at the moment we have about 50-60 female athletes. So every month the XPhys would track the the cycle for each of the athlete, and then based on how the cycle is falling is when we try and make changes on our training load management system, or decide how the athlete will go forward with their training, whether or not they need to see any other medical professional and things like that. So for example, if an athlete is falling into a green category, that means an athlete is getting her normal periods every month, there's no problem, and she's eating adequately, then the training in that case would continue as normal, and the athlete will not be pulled out from the training. However, if an athlete misses her period once or twice consecutively, a nutritionist at the institute would see the athlete and consult the athlete, maybe even give an athlete a diet plan based on the nutritionist's judgment. So that's when the athlete would see a nutritionist. If an athlete is missing her periods 3 or more times, there's going to be a further follow-up with a gynecologist. The athlete would go under some sort of medical investigation, and the nutritionist would follow up with an athlete again. And here is when we try and manage the load for the athlete a little bit, because for us, if an athlete is missing her periods for 3 months, that's really when we start to not just focus on making sure the energy intake is adequate, but also try and manage the expenditure a little bit, so that there is more energy availability and the athlete is not falling into the classic category of low energy availability. So that's when we really try and tweak in all the components and make sure that the athlete, is able to resume her periods naturally, the next month. So that's really what our target is going to be. And for us, it really helps out, and we try and focus on menstrual tracking is because most of the time, of course, if you're working with female athletes, the first thing that you're going to see is the absence of period or the changes in period. So it's really a very easy to do and a quick sign on how your athlete's health is. So what we do here is we have given away a calendar, like, really old school, just print a calendar, give it to each athlete, and the athlete marks the date. So it's not only helpful for me who's tracking the athletes, but it's also helpful for them to be, to be mindful of when their period dates are, to be able to plan better, things like that. Because before we started the process, the athletes were so oblivious. They would not even remember what their period dates were. They wouldn't even remember if I asked them, did you get your periods 2 months back? So we could see that, there is this sort of attitude that's falling, so we wanted to make sure that the athlete knows and is accountable and really trying to be on the top of this. So a calendar system or a phone app, things like that could be used with an athlete. And most importantly, if an athlete that you're working with has missed her period for 6 or more months, then this is really a big red flag. And at our institute, we would stop the training for that athlete, and of course the athlete would go through a thorough medical examination, see a gynecologist, nutritionist, psychologist, and other medical professionals if need be. Coming on to the semi-annual biopsychological assessment. So like I mentioned before, LEAF-Q is very important. We use that with the athletes the moment they start training with us. So if a new athlete comes in and we need to get sort of a baseline or know whether an athlete is falling into the category, the exercise physiologist would fill in the LEAF-Q with that athlete. So how this LEAF-Q works is if a score is more than 8, the athlete would be at risk. So of course, if an athlete is at risk, that is suggesting that we go for more investigation. And what we do in that case is use a mood questionnaire, so a profile of mood state, which is the POMS questionnaire, and an eating disorder questionnaire, which is the EDEQ. And if the athlete is at risk of POMS, which is, if we detect any sort of mood disturbances for the athlete, the psychologist would go ahead and see the athlete. Similarly, if there is a high eating disorder score, which is based upon mostly 3 or 4 categories. So if the athlete has a lot of shape concern, if an athlete has a lot of weight concern, they have restraints, or if each of those variables is presenting with a high score, we share the results with the nutritionist, so the nutritionist knows what the athlete's tendencies are, and then a nutritionist and a psychologist would consult the athlete. And like I mentioned before, it's really a role of the multidisciplinary team where an interaction is maintained with the other practitioners who are directly dealing with the athletes to make sure that the system is streamlined. And a health monitoring or a yearly health screening would include blood analysis, cardiac screening, like I mentioned before, which would be your stress ECG, your resting ECG, your echocardiography, and a consultation with sports physician. And lastly, I would just want to discuss how our weight management system, because we're working with combat sport athletes here, so of course each of those athlete has a weight category to maintain, especially the older ones, if not the younger ones. More relevant for the elite level or the national level athletes that need to be maintained at a certain weight category. So how we do that is we track the athlete's weight every week, and based on their difference from their actual category. So say if an athlete's category is 65 kg and an athlete is 66 kg. So I will see that they're less than 5% above their target weight of 65. So they would fall into a green zone. So if you see the top here of the arrow, if an athlete is between a 5 to 8% up of their weight category, they would fall into an amber zone. And if an athlete is more than 8% of their target weight, the athlete would be into a red zone. So of course a lot goes into it, and there are different strategies to bring an athlete back into a green zone, and the nutritionist has to play a huge role when we're dealing with such a system. And in some cases that would also require involvement of other athletes if it's in case of eating disorders and things like that. So I hope this system gives you a framework of how you can use the different variables from REDIS and really be proactive and really just try and design it based on the athletic population that you are with. So just try and give you a practical framework of how it would look in a setting, because it can be really overwhelming to see all these big papers and you don't really know how to really use it practically. So this is the system that we are using here at IIS, and I think with that, just wanted to share with you this article that came out on Indian Express based on this project that we've been doing on the athletes. So if you want to go ahead and read this, it's really very interesting. The findings that we found from tracking the athletes, going through their medical profile. So that was just when we started the process, and a few months in, and there were really some remarkable findings there. And lastly, what we really need to do is make everyone aware of the negative effects of chronic low energy availability. So if you're working with athletes, an athlete health is of prime importance, so we can make sure that the athlete is healthy and can perform to their maximum capability. So awareness not only to the athletes but also to all the other staff working with the athletes, so the coaches, the family, the other sports science team, everyone really needs to be aware. We need to come up with practical tools that would be helpful in our own system. And then lastly, eliminating toxic training environments. So we don't want an athlete to be, say, abused or body shamed or things like that. So we really need to make sure that we are creating a healthy environment for the athlete. Thank you very much. So Vipul, for the health aspect of our athletes, so we try and really follow a proactive process. So like I shared in the framework as well, we have a pre-competition medical assessment for an athlete. So we have a pre-competition medical assessment, so a PCMA that an athlete would fill up when an athlete joins. We do a thorough health screening, including cardiac screening of an ECG, stress ECG, resting ECG, echo, and musculoskeletal assessment. So that's one big part of pre-screening. We also have the athlete fill up the leaf queue, so we can identify if an athlete is predisposed to or at risk of female athlete triad. So those are the health monitoring systems, and then of course it will be followed up with other semi-annual and annual assessments. Okay, thanks Vipul, if you could hear the answer. I think I see another question. Do you suggest variation of training load for athletes based on the phase of their menstrual cycle? Research suggests in certain phase might be yeah, that's a good point, Nishit, but I think we also need to be mindful of what the subjects were when we read about the athletes, because we need to try and bring that research into our context and see how it best applies here. And when we're talking about menstruation, each athlete would go through, her own set of signs and symptoms. So it's a very personal thing. Some would be comfortable in training, some would not be comfortable in training. What advice I always try to give to the athletes is listen to your body. If you think that you can train and if you can, perform, then go ahead, and there's no taboo that you don't have to exercise during your menstruation days or anything like that. If you feel healthy and you can do it, go ahead and do it. However, if you're struggling and you're in pain, go speak to your coach and see if you can take that session off. So it really depends on that. And where it comes on modifying the training, we've not been doing that here because I want to make sure that it's really relevant for what our athletes are doing here. I hope that answers your questions. Also, what will be your tips on female athletes getting into their teens when we see most of the hormonal changes and psychological hurdles? I mean, for us, we really try and put them in the big group. And, in case of an athlete being in her early teens and not getting periods, that would be another case. But in terms of their training, for most of the athletes, what we try and do is do a peak height velocity assessment, so we can base their training more according to when they're reaching their peak height. If we need to cut down on the plyo that way, if we need to focus on the strength training more. So that's our approach going to be for younger teenage athletes. And we always try and make sure that they have some sort of support system. That was also one of the reasons to create such a project here at IIS. So the athletes know that they have someone that they can go and speak to if they have any issues related to menstruation. So we have, the athletes feel comfortable and they feel like they have a support system, and we'll take necessary actions to do whatever to improve the athlete's health. How energy deficiency in sport to optimize athletes' health or performance. So we really need to make sure that the athlete is not falling into an category of energy deficiency. If, for example, an athlete needs to lose weight, then there are better ways of doing it. So we need to make sure that we're how do I say? We need to make sure that the athlete is seeing a nutritionist and able to reduce weight in a healthy way. So we have brackets of safe weight loss. So say for a male athlete, we wouldn't want the athlete to lose weight as much that they're going below a 9% of body fat. And similarly, for a female athlete, we wouldn't want an athlete to start going below a 15% of body fat. So, markers like that would help us identify if an athlete is going into an energy deficient state or an unhealthy state. And of course, with that, we can expect potential consequences on an athlete's health and performance. How well does metabolism affect in their workout routine? I think I would need some more information to answer that. I'm not too clear on the question. But if you look at the REDES model, if an athlete is at a chronic low energy deficiency, that would impact on their metabolism as well. So of course, their metabolism rate would go down. This also happens in cases where someone is not an athlete. They think that they will try and cut down on their energy. They will try and skip meals to cut down on their weight. So decide just, okay, I'm not going to eat any dinner. But that can also have consequences on their metabolism, and that is not a healthy way to lose weight. So we need to make sure that we are eating the right amount at pace it throughout the day, distribute the meals through the day, so we can really try and optimize the metabolism as well. It was very, this is not related to that. Can you guide me on what path? we can have a discussion about that later on. Yeah. So where I'm not sure on how to answer that. I studied my exercise physiology from Columbia University in New York, and there are a lot of other institutes that are coming up in India. So maybe you could look up at those institutes for your bachelor or your master's level or your PhD, whichever education level you're at currently. Awesome. I'd be happy to take any more questions if you have, or if you want to just ping me later on, reach me via Facebook or LinkedIn, and we can take it from there. Thanks. I really hope you guys got to learn something new and learn a little bit more about Redis and how we can really be proactive and identify if an athlete's health is being compromised and the performance is being affected, because a healthy athlete would always perform better. So I guess I'm going to just sure, Athar. I'm going to just end the video here. Please feel free to reach me later on if you want to. Thanks, everyone. Bye.